You guys, it's Wednesday, and Wednesdays we work out a practice question. So this week we did 2 practice questions because for Topics and Tips Tuesday we covered COPD and asthma. So I wanted to give you a COPD practice question as well as an asthma practice question. So question number 1 states, a 60-year-old male with a history of COPD presents for a follow-up appointment. The nurse practitioner notes that the patient's FEV1 is 60%. The patient currently takes albuterol. How should the nurse practitioner treat? Select all that apply. Okay, so we know we look at the stem of the question first. So it's asking, how should the nurse practitioner treat? Remembering that you're selecting all the correct answers because it tells you to select all that apply. So we got to see what we're dealing with if we're treating the current situation. So we know that the person has COPD. Their FEV1 is 60%. So that makes us stop and think, which gold stage are they currently in? So there's 4 stages. Stage 2 is the moderate stage where the FEV1 is anywhere between 50 to 80%. So that's where this would fall into since they're 60%. And the patient is already taking albuterol. So what would you do next? So in the moderate stage, we know that we have them on either a SABA or a SAMA with COPD, PRN. Then you add a LABA or a LAMA. Then you put them with a flu vaccine if it's flu season. And then you refer them to pulmonary rehab as well. So in this case, albuterol is a SABA. So then that means we want to add in a LABA. So that means A would be our LABA because salmeterol is a LABA. Correct. And then our flu vaccine. So when in season, we do our flu vaccination. Remember, that's anywhere from October to March. And then you want to refer D to pulmonary rehab. So the answer to number 1 is A, B, and D. C is an inhaled corticosteroid, and you don't need that in this stage. Question number 2 says, Mr. Williams is a 57-year-old male who presents to the office today with complaints of shortness of breath. The patient states that he is waking up at least 2 times every month, gasping for air. He states that he cannot figure out what is wrong. How should the nurse practitioner treat? So again, the stem of the question states, how should the nurse practitioner treat? So we're going to take a look at what's going on. So he's 57. He's having difficulty with breathing. His shortness of breath is causing him to wake at least 2 times every month, gasping for air. So it puts you in the mind of asthma. So therefore, then you think of the asthma stepwise approach. So what symptoms happen at least 2 times a month? And that's your intermittent phase. So this is indicative of the intermittent phase of asthma. So then you have to know, what do you do in that phase, right? So in the intermittent phase, all they need is a SABA PRN as a rescue inhaler so that anytime he has those symptoms a couple of times a month, he'll just use his rescue inhaler as needed. So salmeterol, no, because that's a LABA. Albuterol is a SABA. So B is your answer. All right. I hope that you found this helpful. As usual, meet me back here on Wednesday. Share with a friend. And keep joining me for our Work It Out Wednesdays. All right. Talk to y'all soon.